I'm Mike Fagen. I am faculty here at the UIC School of Public Health in the Community Health Sciences Division. I'm also core faculty in the DRPH program, where I teach one course primarily. It's a second-year, first semester course called Integrated Methods. And the purpose of that course is to teach DRPH students how to really do applied research and evaluation. I know that many students come into the program with some skills in those domains, others less so. So the purpose of that course is to really enhance students' skills, and now with the second methods course, to prepare them to do their theses. But a little bit more about me. So my research interests are primarily in three areas: school health promotion, prevention, and evaluation. And I tend to be happiest when those three areas combine. One example is a project I currently work on called Communities Putting Prevention to Work, which I'm presuming many of you have heard of before. It's a large federal initiative intended to reduce obesity or tobacco use, depending on the type of grant. I work as part of the Mid-America Center for Public Health Practice here at the School of Public Health on the Suburban Cook County CPPW, that's the acronym, which is an obesity prevention CPPW. One of the really noteworthy pieces of these CPPWs is that instead of targeting individual behavior change, even if it's aggregated at the population level, these grants are targeting policy, systems, and environmental change. So for example, with obesity, that means getting more fresh fruits and vegetables and healthy choices into corner stores and other areas where those might not abound. Paving what we call complete streets, in other words, streets and roads that are not only car friendly but also pedestrian and bicycle friendly. And in my area, school health promotion, putting good healthy choices into vending machines, changing school meals, increasing physical activity opportunities at school, adding to or changing recess. So these are the kinds of things that our CPPW tries to do, and in this day and age in public health, it's considered fairly innovative. The challenge is evaluating that, and that's where I and my colleagues come in. So how, in fact, do you measure change to policy, systems, and environment? It's, as you might imagine, considerably more difficult than measuring individual behavior change. That's one of the projects I work on, which involves a number of DRPH students. And more generally, my work, whether it's research, teaching, or even service, tends to involve students quite meaningfully. So that's the CPPW project. Another example of my research is work that I do based at the Institute for Health Research and Policy, which is another unit here on campus associated with the School of Public Health. And that's a long-standing research agenda involving school health promotion again, but doing randomized controlled trials of prevention programs in schools, which is the way that we establish the effectiveness of these programs. Now, the interesting piece, or I should say most interesting to me, is the effect of these programs on the school as an organization and the teachers and other staff who work there. So for example, in our most recent randomized controlled trial, I've been working to assess the readiness of the schools to actually take on the program. As you might imagine, in this day and age, it's very complicated to get what's seen oftentimes as an extra or external program into a school that is highly pressured to increase test scores and to really target student achievement. So it's been very interesting to assess the readiness of these schools to, in fact, undertake the work. Another piece of that research is a series of teacher interviews that we conducted. We call it our teacher implementation study, to get a better sense for what it takes from a teacher perspective to take on an external program and implement it in a program and school-wide. One other area of research that I'd like to highlight is work that I do with a local nonprofit called the Illinois Caucus for Adolescent Health. a big part of that agency's mission is to promote comprehensive approaches to sexuality education in schools as opposed to abstinence-only approaches, which, as I'm sure many of you know, have received a lot of funding from the federal government over the past 15 or so years. Thankfully, that's changing, but for all of that time, this agency, which is known as ICA, has been working to promote comprehensive sex education. And one of its main strategies is to promote either new or enhanced school board policies for sexuality education. Those policies either don't exist or tend to be abstinence only in a lot of parts of Illinois. So what ICA does is work with folks in and around schools and students as well to try and change those policies. And once again, my role is not only to advise on that work, but also to handle the evaluation piece. And we've learned a great deal from doing that work. So that's my research in a nutshell. And looping back to the teaching piece and this integrative method seminar that I teach in the DRPH program, I do my very best to bring all of that experience into the classroom. And the classroom now is virtual. So, as you know, courses in the DRPH program are delivered from a distance. We do that via technology known as Adobe Connect and Blackboard. And even though we are working from a distance, I find that it's very straightforward to bring all of these examples and experiences into the virtual classroom. And I know that based on student feedback, students tend to really like grappling with evaluation and applied research questions, based on real life experience, not only their own, but the ones that I can bring from my experience into the class. So I'm really happiest when my teaching, research, and even my service all comes together, and I think the DRPH program is one of the places where that really happens. So this is a great program. It's wonderful that you're either in the program already or interested in it, and now that you know a little bit more about my interests, I encourage you to get in touch with me if you're looking for any more information.